Another area, and this is across boys and girls, is stress and mental health. We are not thinking about it as often. We are in a very different world
Here and
now
now.
than when I grew up.
I know.
Yeah, didn't have access to devices and social media and cyberbullying, and
You didn't have Instagram social handle?
I didn't have. And let me tell you the
Dr. Sathya official. There's a two handles, official and personal.
and personal, right? And the kinds of impact that has on your cognitive state, right? Moving from reel to reel to reel to reel, attention spans. We are now setting the tone, right, for shorter attention spans, which translates into the classroom as well. We, are the amount of cyberbullying, or even in the classroom, because of the exposure, the bullying that happens is almost subliminal at some point, and we don't even realize that it's happening and the impact it's happening on the child. And therefore, all of that stress, along with, of course, the academic stress, right? We are a privileged class of people that want more education and academic achievement for our children, because as a country, we know that sets you up and your family for a very different economic path, right? And that adds more stress and success. All of this ends up being mental health disorders that are increasing among children. And it's not easy to talk to your parents about it.
So what do? You talk to your kids, the kids separately?
We try, right? We try and talk to our kids separately. And the only way to do it is to not sit them down and have a lecture. We have to actually be part of their lives, understand what their school day was like, talk about their friends, talk about what's happening with their friends, right? And other students in the class. Ask probing questions from the point of view of simply understanding what their day is and start picking up some of the issues. If the same friends' names are not getting repeated, right? Should that raise a red flag or not? If they talk about someone else, feeling sorry for them, right? Understand if something like that has happened to them. And also share your day. That's a great way to get kids to open up. Let's be vulnerable with our kids, right? I don't remember my father sharing his day with me, right? But I think that in today's day and age, to be able to have a conversation and share your stressors with your children allows them to then feel like they can also open up with you. And if it's not possible, right, and you're still hitting a wall, enlist the help of the school teachers. Enlist the help of a pediatrician. I find that my pediatrician is able to get through to my daughter far easier than I can. And I think that having them actually have a conversation with your child when you're not in the room is usually a good way to break the ice and get them to, open up and share. We've actually created a Pro Health for Children based on these issues between 10 and 16, right? And added in these elements only if you need them, right? We have to be careful about also over-testing, right? So simply putting an ADHD questionnaire in front of you is not going to cut it. You only if you pick up signs of it, right? And you suspect that there might be aspects to actually test, then include it, right? Let's talk about another area for this age group, dental and eyesight, right? Eyesight much earlier also. Even as a 5-year-old, you should be testing for it and picking up simply what's going on.
Why is pediatric dental?
Yes,
it's not being considered screening at all here, and it is a completely different picture in US.
That's right.
It's a completely different picture.
Again, driven
but
by
again,
insurance.
US is not being covered by insurance.
It's not being covered by insurance,
and we pay.
Yes, and I think it's the awareness, right, around that. We are now beginning to see an increased number of dentists and increased awareness around dental issues. But we don't take it as seriously, and we don't think about it as screening. Oral hygiene contributes enormously, is connected to your gut connected to your cognition, right? All of our body systems are actually interconnected like this, and very important to take care of some of these issues early. We know the answer. You have to do the screening every 6 months. All right. And if your schedule doesn't allow it, at least once a year. Please make that a priority. Right. And we know that excessive sweets and not cleansing after meals.
I mean, 2 times brushing, flossing is something that I have never heard
Yes.
myself.
Yes.
Okay, I was so surprised that people were flossing. I mean, dentists were asking me flossing. I said, I've never flossed ever in my life. After 20 years.
That's right.
Then I was realizing, it would have been a different thing if somebody has told me,
That's
okay,
right.
can you floss when you are around like 10 years of age?
And then it becomes a habit.
It becomes a habit.
Right? The problem for us right now as middle-aged adults is to start a new habit. Habits form early. We do not think at all about getting up in the morning and brushing. It
correct.
is such a part of your lifestyle that your brain doesn't even have to think, right? You just get up, you walk straight into the bathroom, you pick up the toothbrush and you go. That's how we have to make screening as well.